that we recognize that we have no other country but this one.
When you give birth, you want to follow the vaccine calendar to the end. Yeah. But most people do not really understand. You go, they give you the polio, they give you the DPT vaccines, the yellow fever vaccine, and all of that, but they don't understand what this is. If they had a better understanding of what this is, they'll explain to their children, and they themselves will gain knowledge.
Welcome to another exciting episode of Back to Doc. My name is Ike Ogbonna, and with me is the beautiful, delectable African goddess, Adele.
I did not pay him to say that.
No, but that's what you are. You're an African goddess.
Neither did I pay him to say that. But I'm very happy to be back here having conversations that help Africans make decisions about their health. And today we're going to be diving into something I met when I was really young in Kenya, and I still distinctly remember seeing the vaccination process happening and wondering, okay, where are these people coming to our house? Where is there an X on that gate and ours doesn't have? And I'm talking about polio.
Yes.
And to help us do that, we have some amazing guests.
And with us today, we have Nora over here, and we have Leah, who will be helping us to make this episode even more exciting. So, Nora, could you mind telling us more about yourself?
I'm Nora Mbinglo, currently a clinical research professional, but basically trained as a nurse. And I have been active in this polio campaign for like 20 years.
What?
Back in the days when I was still training to become a nurse.
Yeah.
Climbing and descending hills to reach out to families.
Oh my goodness.
Yeah.
Can't wait to hear more.
There'll be a lot of
experiences.
Exciting.
Yeah.
It's an exciting experience.
Yeah. And so maybe we can hear a bit more about you, Leah, who's from my home country, Kenyans representing.
Swahili.
Yes, I'm going to speak in English, but maybe we can throw in some Swahili.
I know.
Well, I know Nakupenda.
Of course, you know.
Out of the way,
It means
Nakupenda.
I love you.
And you can add sana to it, right?
Nakupenda sana.
No, you're not saying it well. Sana.
My goodness. So Leah, you can tell us a bit about you.
Yes, so my name is Leah Mwai. I'm a researcher and innovation expert. I would say enthusiast. And I've been working in developed voices of everyday people into the conversations that are more scientific, about health, about decisions that are made about them. So really excited to really talk about this.
Yeah, and that's really important because sometimes whatever happens in the lab stays in the lab and people speak in terms that only people in the lab understand, but it affects the lives of everybody every day, right? So I remember polio from when I was much younger, and the X's on the gates, I think it's probably the one and only time our country, Kenya, was organized. Because I have to say the vaccination process was very organized for polio. And I remember like once they're done with one house, you get an X, and then you're all waiting for, okay, when are they coming to our gate? You know? But how did you guys first hear of polio? Was it the same in terms of your experiences?
For me, I can't really remember when I first heard about polio, but I would say when I first really became aware of it, I was involved. Back in the days when I was in school, when we had to do internships in hospitals, the campaigns were going on, so we're forced to join the staff to go out during these campaigns to vaccinate children.
So let's start with a quick definition. What is polio?
Poliomyelitis, actually. known as polio. It's a very contagious, infectious disease caused by a virus that mostly affects the muscles, weakens the muscles, leading to paralysis. And in severe cases, it can lead to death. Yeah, we have that. Before, back in the days, like in the 50s, in the 60s, it used to be very terrible. Yeah, it used to be very terrible back then. But now, thanks to vaccination and surveillance and education, awareness, you see, it has actually dropped. Right now in the world, we are talking about the eradication of polio. Just to let you know, back in those days, you used to have about 3,500 cases of polio in more than 125 countries. You understand? And you know what that means. Like I said, it leads to death, it leads to paralysis. So you can understand paralysis, You can understand what that means. But now, when we talk of polio, you see we are 99.9% on the route to eradication, which means what is left? 0.1. And what is happening and where is that? Unfortunately, we still have polio around. It's not gone. That's why we're talking about it on this table. It's still there. It's not eradicated. We have polio in Pakistan and in Afghanistan. I think it remains endemic in these areas because of the insecurity in the countries when the campaign was going on globally. This country was had to rage due to the poor governance, insecurity, and of course we know the mixed feelings people have about vaccines. But thank God, like I said, we are almost there, getting 99.9% to eradicating polio. But again, not only that, we have cases in Africa too. Right here, yeah. We have in Congo, we have in Cameroon, we have in Nigeria, we have in Ghana. So these are countries which were already declared polio-free. But now we have new cases.
And I have to say, I love your definition, because when I think about my first interaction, the only thing I remember is like the X's on the gates and the end result. I know there was a lot of talk of paralysis, etc. But the in-between, I didn't really get that. Was that the same for you, Leo? Or do you remember actually being explained to exactly what polio was when you first heard of it?
Yeah, I was just trying to think when you guys were talking. I think my very first vivid, when I can remember I first encountered polio was in high school, because one of the teachers that had the most impact on my life, he was our art teacher. He used to walk on crutches and he was paralyzed. And we always wondered where that came from. And I think later when when you're students, you ask, and we learned that he had caught polio as a child. And of course, then I went home and asked my parents, what's this polio? What is it? And I think they explained that my grandmother especially talked about how that was a disease, like in that age group of my parents and before. People were, catching it and getting sick, and that, okay, that's why we get vaccinated. So there's a little bit of that explained. And I think the only other thing I remember, apart from the X's that you're talking about, was the Kick Polio t-shirts in Kenya.
Oh, yeah!
Do you remember the goodies?
Oh yes.
You got a t-shirt.
And we had all this.
Yes,
right?
exactly.
The kids got t-shirts.
Yes, we got t-shirts. So there was all this. So there was a lot of people, if you go to the market, who are wearing these t-shirts that are written Kick Polio, and they were like representing the polio campaign.
I remember Kick Polio.
So I think they really, yeah. So we all knew somehow. And like there was this consciousness in the society that there was something called polio, and we were kicking it.
Yeah, exactly.
It was kind of visible.
We had access.
Yes, and like kind of for me, as I said, I still remember, because my teacher, he was an art teacher, and he was very, very like even now I just remember him and really wondering, oh, how did he become like this? And then learning that this is, when I asked, I learned that this is, this disease is the one that causes this in the population. Yeah. But that happened more in my parents' generation and before.
It's very obvious that vaccination helps to prevent polio, but how can we cure polio? Can it be cured?
Unfortunately, there is no cure for polio, but polio can be prevented. Yes, there is no cure for polio, but it can be prevented. For us to be able to prevent polio, we need to create awareness, educate the people, and most importantly, what the main thing that prevents polio is the vaccine. There are actually vaccines against polio. There are two kinds of vaccines. You have the OPV, oral polio vaccine. You have the IPV, polio vaccine, which is injectable. These vaccines are actually available. I don't know, back in Kenya, what did they give you? Were you injected or you were...
We got the t-shirts.
You got the t-shirt. And I bet they dropped something in your mouth. Yeah. That is the oral polio vaccine.
I remember we were kids then.
I know.
Yeah.
I just went to the hospital with my parents.
Yeah. They'll remind you. And even nowadays, it's still going on. Like, we still vaccinate kids. So you have the vaccine. There's two kinds of vaccines that are very available and have been integrated into the vaccine calendars for children, because polio, you should know, mostly affects children. I mean, it can affect adults, but I mean, we've gained some immunity. One thing you should also note is that this polio, out of 100 people that it affects, about 90 of them go unnoticed. They are asymptomatic, no signs and symptoms. You understand? Yes. So back to his question, how can we cure polio? Polio is not curable, but it is preventable. Okay. Yes. So far, what has proven to be very effective is vaccination.
The vaccination, is it a one-time thing, or is there an expiry date? Would you need to take it again?
For you to be able to actually gain immunity from polio, multiple doses of vaccines should be taken. In the calendar, you have vaccines given to children at birth. If any of you have witnessed childbirth, you realize that immediately after birth, they give them something. So they give them polio at birth, that's 0, polio 0. Polio 1 comes in at week 6. The next one at week 14, I think, or week 10, 14. And then you have that, they take 4 doses, and then you have those booster doses that come now when you do these polio campaigns, when they come now around doing those booster doses. Yeah.
That's so interesting, because like now you're talking about terminology that we heard with COVID when you're talking about boosters and things like that. And I thought I was meeting this for the first time, because I guess back then I was focused on the t-shirts and not the real issue. But I'm just wondering, when we talk about like polio in terms of like a virus, what about the environment that people are in? Where does it come from? Does sanitation play a role?
It does a lot. So for polio to be transmitted, it is transmitted through the fecal-oral route. When they say fecal-oral, feces, oral, the mouth. So when you come in contact with the feces of someone contaminated with polio, and you have means that can be transmitted through water, through food, it gets into your system. So that is why in the fight against polio, we don't really talk about the prevention by vaccines, but also highlight a lot about environmental hygiene and sanitation, good hygienic practices, hand washing, good toilet practices, and all of that. They play a very big role.
So you think can adults still take the vaccination?
Yeah, because it is not. We wouldn't say we don't at this point, since it affects a lot of kids and not adults. Adults are not exempted. You understand? The target is kids, because we have little or no cases with adults, but the target is kids. The adults can still take the polio vaccine.
We should do a lot more communication around adults, because it's very funny that when you leave your parents' house, you just go into the world and you forget about vaccination. When you're sick, you go to the doctor and say, I think I'm having a headache. But I think we should do a lot of more communication when it comes to vaccines that adults should not take for granted, and if there's a need for adults to still go back to the hospital and get extra vaccinations.
Yeah, there's something I would say. I mean, if you're pregnant or you go to the hospital, you're only caring about your child. Mm-hmm. You understand? And when you give birth, you want to follow the vaccine calendar to the end.
Yeah.
But most people do not really understand. You go, they give you the polio, they give you the DPT vaccines, the yellow fever vaccine, and all of that, but they don't understand what this is. If they had a better understanding of what this is, they'll explain to their children, and they themselves will gain knowledge and understand if this can affect my child, and I'm at risk as well. Why don't I go in further?
Exactly.
So when we're educating, like say, you educate adults and you educate kids as well, especially for the hygiene and sanitation part, but the adults should be able to know that it doesn't only imply to them giving vaccines, holding up their kids for vaccination, but also they have a role to play in the sanitation and also on their own part, their health, getting their own vaccines.
And so I wonder, Leah, what your thoughts are, because I feel like you're a feisty, what do you call it? Active citizen, not activist, active citizen of this continent. When we talk about issues around hygiene and sanitation, I know I feel a type of way whenever we're told, like, you have to wash your hands, you have to do ABCD, when accessibility to that is not the case for everyone. Unfortunately, it's a privilege. Like, what are your thoughts around how we organize, even in terms of just like public health, plus also the situation in communities? Are we preparing well, or are we just living in some sort of bubble when it comes to African leadership around these issues?
Yeah, no, that's a really interesting question. I think, personally, I think one of the things that strikes me is this idea of hygiene. It has a colonial connotation, if you think about it, Hygiene is somehow, at least the way sometimes it's received by, by the normal public, because this is something the colonialists were supposed to be bringing to us, right? Like, we were supposed to be, part of civilization is getting clean, cleaning yourselves and everything like that. And it almost puts a lot of, I would say, responsibility on the citizen, when actually sometimes, a lot of times, for you to achieve that, you need to be enabled by your government, right? You need, for instance, like hand washing. Unless there's clean water around and taps around, even when you're telling children, like, for them to be able to effect that, they need to have clean water in school or wherever they go to be able to do that. Otherwise, it can seem sometimes condemning or like belittling to tell people, you need to, it's your responsibility to be clean, to wash your hands, to do what, when sometimes, a lot of times, we don't have that clean water. Yeah. We don't even have those taps. We don't have running water. And so I think it can bring a bit of shame, to be honest, like making it very much just about the individual without considering the responsibility of the government or whoever is responsible for providing that facility for us to be able to do that in our homes. I think the other thing I would say is, in a lot of places also, hygiene, as she said, I think you said it's about feces and water mixing. Part of that is not, feces and, what the water we drink coming into contact, that's really not an individual thing. A lot of times it's just whether we have, to what extent are we enabled within our societies to make sure that, because a lot of places, if in our countries, we don't have really good, like in Kenya, like a lot of places, we don't have toilets. Like some people don't have access to good toilets. Yeah. So that means sometimes they defecate in the bush. Yeah. So I would say like streets, exactly. So I think there's a bit of sometimes feeling disempowered, like feeling like we're supposed to do this, but there's no way to be able to achieve it at a personal level, because the environment that we live in that is not about us has not been enabled.
I agree with you, considering the fact that we in Africa, a developing continent, developing countries, but one thing you should know is that for us to be able to get to this 99.9% of polio eradication, it's not only thanks to vaccination. There has also been the creation of other campaigns to improve environmental sanitation and hygiene, pipe-borne water. Yes, I understand. In my country as well, Cameroon, you find that not every area has pipe-borne water or has these facilities. But alongside in fighting this, just like in fighting other diseases like cholera, the government makes it possible for some of these areas that are really at risk to have this facility. So it's not as if it's a challenge. That's why we're still here. And thank God, even though we live in these situations, we are still able to eradicate the polio in that area. But we cannot forget, it's not only about having this pipe-borne water. The basic, personal hygiene, you understand? If you miss it, you miss it. And if you come in contact with the virus.
So I found it very interesting when you mentioned colonization and hygiene in the same sentence. I don't think I've ever heard that. And so I'm thinking, if we go back there, weren't there things as Africans that we were doing that were healthy and that were good in the community, even when we think about like sanitation? We definitely had some processes that were effective, right? What do you think?
Yeah, I mean, I'm trying to think how we would know because we weren't there then.
Yeah.
So I think I'll just draw on what I kind of heard, like asked from my grandmother and what I've read a bit of. Although, as we know, we don't usually have a very good record. But I think the first thing I think is that definitely I think there was better separation between fecal matter and water, like water sources, like rivers and stuff like that than today. And I also think, and that made it a bit more safer to drink water from the river, for example. So this idea of tap water was probably not as pressing,
Yeah.
exactly. I think the other thing that has changed a lot, obviously, is this idea of urbanization and slums. That obviously we know that was unheard of during, before, I guess, colonial times and before this era. So, and I think part of the issue around sanitation is just also these slums, having too many, urban slums, places where many people are staying without the adequate design for sanitation and how to handle urine and feces.
So it's interesting, like when we talk about like urbanization, this is just so interesting to me because we talk about urbanization from a development perspective, but we don't know how it touches on health. So if you're creating a space where more people live, you then have to make it safe so that we don't have health crises like polio or cholera, etc. And what about the government's role? What do you think? Like, was the government's role in polio, and they were effective things they did? Because I mean, going back to your number, 99.9%. Yeah.
Without our governments, we wouldn't be here to talk about this 99.9%. So back in the 80s, the World Health Assembly passed a resolution to eradicate polio. Thereafter, there was the Global Polio Eradication Initiative that was led by the CDC, WHO, our governments, Vaccine Initiative, Bill and Melinda Gates, Gavi, and all of those other organizations. This is what helped to implement the polio eradication and campaign in our communities, in our countries. Because like I earlier said, the polio vaccine has been introduced into our vaccination calendars for kids. So if you go back to Kenya, if you go to Nigeria, if you look at the polio vaccine, the vaccination card for kids, children under 5, you're going to see that all of these vaccines have been introduced at 0, at 6, and all of that. So the government has actually played a very important role, and they continue to play these roles, especially now that we're talking about getting to the end of being eradicated. I don't remember if I already mentioned about the new polio virus variant circulating in Africa, where we have in Congo, in Cameroon, Nigeria, in Ghana, like that. Yes, so for us to be able to identify, it's not just about saying that, polio was eradicated and we fold our arms and say, no, there's a lot of surveillance going on in the background. Yes. So this
point where we would have a total complete eradication, 100%.
100%, 110%. Definitely, yes, because if we could come from the 80s, cases where you had 350,000 people in over 125 countries. And as of now, 2021, 2023, we're talking about 6 cases of polio in Pakistan and Afghanistan. Then you see how that has come over a period of about 30, 35 years. You understand? And if we continue with this fight, you're going to see that in no time, we'll probably eradicate polio. And just to let you know again that back in 2014, the Director General of WHO did put polio on the list for public health emergency of international concern, which means that all eyes, the international community, has to look back at polio. Polio is not eradicated, so they brought back that to the table. Things like COVID mpox were on had that same status, but they're out of it. But polio remains, which means that, yeah, they're still focused on it. And there's work going on by these governments and organizations.
If we go to education and how we even teach children about, like, washing hands is something that you'll hear in classes, but it ends with a song. You're never linked. It never tells you what else could happen or whatever. So even
it's
when
usually about passing the exam.
yeah,
It's not about
exactly.
my life.
Or the song. There's like a song, da, 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 da,
You know,
and then it's
I
over.
find it
So
really hard
you have to break it.
to relate, because I've actually seen and I've been involved. It's true that I may not have been able to evaluate the impact of the outcome, but I have seen situations a couple of times where there is this advocacy for personal and environmental hygiene. You understand? Where like the community begins. Where's the first community? The family. So by the time the teacher is telling a student, what do you do to maintain your personal hygiene? And if that child already has information from the home, you do this, you do this, you do this, and they'll be like, okay, this child knows. There's really, I mean, the government, we are the government. They do as much as they can do. But again, there is this core, we as citizens. As citizens, we have to understand, for example, what polio is. Create this awareness. We will not wait. Take, for example, I'll take you back a little bit to COVID. You mentioned COVID and said, I agree, we're overwhelmed. And we saw it happening in other places, and we're praying that it shouldn't come. And when it finally came, we're watching, and everybody was overwhelmed. What I would like to say is that our governments were not dumb. You understand? They tried to weigh the risks and the benefits.
We all want an end goal of people having access to knowledge that allows them to make the right decisions, and that we want people to be able to live in very sanitized conditions. Are we together? Great. I hope you enjoyed this episode of Back to Doc. I sure did, and I hope you have gained information and insights to help you make better decisions when it comes to your health.
I'd like to say a big thank you to our guests today, Nora and Leah. Are there any signing out words you would like to drop?
From my end, yes, polio is still there. It's still in our communities, and there is work to be done. We here, beginning from our families, we have to go out and let people understand what polio is all about, how it manifests, what are the impacts on the everyday citizen, on the community at large. What can be done? There are vaccines. How safe are these vaccines? Let them know. Give them that knowledge. Tell them the importance of these vaccines, and come back again. The basic fact of environmental hygiene, personal and environmental hygiene and sanitation. We wouldn't want to wait for a very big outbreak of polio, and then we start rushing for vaccines or start washing our hands. And no, we already know what we have to do. So let's see how back in our communities, and we encourage the others around us going for vaccinations to take care of themselves. Personal hygiene, environmental hygiene, and I bet you in the next 10 years,
We'll be polio free. The 0.1
Yes.
becomes another episode about
And Leah, what about you?
Yeah, no, I agree with that, but I also want to emphasize the fact that we need to really think about the people that we're trying to support, the communities that we work with, and to remember to always center it around them. And to always remember that whatever we are doing, it's not the government doing at them or healthcare workers doing at them. They also have their own agency, and actually they want to be well. Nobody wants to have polio or have the side effects you talked about. Sometimes the issues we're having is just around how we communicate, how we engage. And I think we should see them as collaborators and people who can bring something to the table in how we are dealing with things, and to think about how we formulate how the actions we want to take in consideration of how they live their lives and some of the hustles and bustles they do. And I think we're going to go further if we do that.
Who's on them, but we work
They're
together
partners.
with that.
Well, it's been an exciting episode of Back to Doc, and you have been of immense help and contribution to this topic. It's really fun having you guys in the studio with us today. Adele, it was nice working with you again.
I know. Although we're on different governments. On this side, yeah, that side, this side.
Our government is winning. Cast your votes right. And I'm sure a lot of you out there have questions to ask. And feel free to always, one way or the other, reach out to us in Niel Campaigns on Instagram, on Twitter. The handle should be somewhere around there on the screen. You'd find it there. Reach out and ask your questions. There will be someone that would respond to you. It's Back to Doc. I'm Ike Obona, and it's good night.
This is the network service of the NTA.
It's the most wonderful time of the year. Oh yes, it is the most wonderful time of the year. Do you hear it? Can you see it? The lights are everywhere. Of course, it's Christmas, and of course, we are always very, very excited about Christmas. Aren't you? You should. It's that time of the year where you get to meet family, friends. There's a lot of food, a lot of gift giving, a lot of visiting. There's a lot of everything, actually. It's the end of the year, and of course, there is everything in abundance in December. But the way the economy is looking now, it's looking like the Christmas will not Christmas as usual, you know. So a lot of people, I mean, I saw a video today. Some guy was traveling, and in the aircraft, usually when it's December and people are traveling, there are usually not enough air tickets, like the bus parks are full, but he's in an aircraft and there are just 3 of them. And it's Christmas. I mean, what's going on? So it's looking like people do not have money to enjoy Christmas like they usually do, which is why we are here today.
Amid economic challenges in Nigerian families requires thoughtful planning and creative approaches. Here is a comprehensive guide. 1. Budget planning. Assess your financial situation and set a realistic budget for Christmas expenses, including gifts, decorations, and food. Prioritize essential needs, such as bills and groceries, before allocating funds for festive celebrations. 2. Homemade decorations. Create a festive ambience by making your own decorations using low-cost materials like paper, fabric, and natural elements. Involve family members in crafting sessions to foster a sense of togetherness and shared creativity. 3. Do-it-yourself gifts. Opt for meaningful, homemade gifts like personalized crafts, baked goods, or photo albums. These not only save money, but also add a personal touch to the celebrations. 4. Potluck celebrations. Organize a potluck-style Christmas dinner where each family contributes a dish. This distributes the financial responsibility and creates a diverse communal feast. 5. Local market shopping. Explore local markets for affordable decorations, gifts, and ingredients. Supporting local businesses not only saves money but also contributes to the community. 6. Family traditions. Embrace simple yet meaningful family traditions that don't require significant spending. This could include storytelling, board game nights, or a family movie marathon. 7. Pre-loved gift exchanges. Consider organizing a gift exchange where participants give pre-loved items to a new home. This reduces costs and promotes sustainable practices. 8. Charitable contributions. Redirect some of your Christmas budget towards charitable donation or community initiatives. This not only aligns with the spirit of the season, but also fosters a sense of goodwill. 9. Sales and discounts. Take advantage of seasonal sales and discounts to purchase gifts and decorations at a lower cost. Shop strategically and compare prices before making purchases. 10. Communication and transparency. Communicate openly with family and friends about the decision to celebrate on a budget. Most people will appreciate the honesty and may even have similar preferences. Remember, the essence of Christmas lies in joy, togetherness, and shared moments. By focusing on these aspects and implementing cost-effective strategies, we can create a memorable and meaningful celebration within our means.
Thank you so much for that insightful feature. It seems to have everything, but of course, I did tell you that we would have an expert in the house who will be, taking us through more like expanding what we just saw in that feature in a broader manner to help us understand. That was quite short, but we have someone to talk about Christmas on the budget with. I'm talking about Yemisi Isidi. She is a business and financial expert. Welcome to the studio.
Thank you.
Merry Christmas in advance. Please tell me December is also your favorite time of the year.
It is. Absolutely my favorite
so
time
share
of the
with me your most memorable Christmas, or maybe something about Christmas that makes you excited.
A lot of things. The food.
Yeah, we all love the food.
It's also a great opportunity to just take a break from work. So
Yes.
everybody is resting, everybody is taking a break, or maybe not as much, but you know that this is a time where people are more relaxed.
I'm not going to agree with you on that, but go ahead. Because not all of us take a break on the job, yeah.
More open to having fun. There is family around, so this is a time where people come together as well. My favorite Christmas memory, I can't remember the year, but I know it was this period where this jean gown was raining for kids. And I was in Port Harcourt. We're in Port Harcourt then, and my dad took us to this amusement park. So we had the horse ride. I had my bowler hat then.
Was it the jean jacket that was making you excited?
It was, that was my Christmas clothes. So yes, that made me excited. And just that, I don't know, but that's like my favorite Christmas memory.
Yeah, we all miss those years when they still used to buy us Christmas
clothes. And actually, I was
clothes.
featured on NTA. I just remember there was an NTA stand at the amusement park, and then you could go and give shout out to your friends.
So you're not new to the family. So it's like saying welcome back home. Okay. So let's talk budgeting basically. First of all, what's budgeting?
Okay. Budgeting is simply telling your money where to go, right? So I really liked the video that was played earlier because it talks about being able to manage your money. So budgeting is telling your money where to go. So what most people get wrong is thinking they will just write down in numbers here and there, or income, expenses, but it is a very data-driven and emotional decision. It is not just something you do because, they say do a budget, right? So you need to be intentional about thinking about all the money that will come in this period, and then telling it where to go.
And ensure that they go there.
That they go there. And then, yes, that's very important what you mentioned, because beyond budgeting is setting the structures that enable you stick to the budgets that you have created.
Oh, fantastic. So we're talking Christmas on a budget. I want to enjoy Christmas.
Yes.
But even if my pocket is not looking like I'll enjoy Christmas, I still want to enjoy Christmas. So how can budgeting be applied specifically to the Christmas season?
Okay. I think number one thing the main thing that money goes to in the Christmas season is entertainment and food, right? So I liked the video. It mentioned being honest with your family and friends. So really, and you just know your family and friends, but to yourself as well, I want to have a great time. I want to have fun. This is how much I have, what kind of weather. You can then see what is left for additional enjoyment. And one way to manage the budgets in the Christmas period, the festive season, is to have a meal plan. I find that having a meal plan, what do you want to eat?
Did you see the way I looked at you? Meal plan during the Christmas season. I mean, I've had a meal plan all year long.
Yeah.
What am I doing? Christmas is for eating. Like,
exactly. So what are the things that you would want to eat that would make you happy?
That I've not eaten the whole year. I want to eat everything.
Christmas period. Okay, and then doing it with family and friends. So with this your budget, maybe you can only do puff puff and someone else can do fried rice. By the time you come together, you have the
collaboration.
puff-puff, you have the fried rice, you
good.
have the chicken. But with your meal plan, you're able to know the food that you need to buy and how much you need to achieve it.
Yeah.
So you know that Christmas period is more expensive. You want to enjoy yourself. It makes it easier if you start planning. And one way to really do that is, so what I do during this time of the year, I sit down and I look at my income and expenses for the year. Am I happy with how much I've made? If I'm not happy about it, what can I do, right? Am I happy with what I have spent? What have I spent on? Were they worth it? Where did my money go to?
Right? I'm supposed to be doing all this.
The reason for that is you cannot really plan for your money if you do not know where it is going, and coming from. So by the time you've done all of that planning, you're able to think, okay, next year, this is the kind of life that I want to live. By this time, by December 2024, this is the amount of money that I want to have, so that like these things that I may not be able to do this year, I can do next year. But these things will not happen by just thinking about it or wishing for it. So the planning may look hard, but it is important to know
it's a lot of work.
Yes, where do I want to make money from next year, and where do I want my money to go to next year, such that December 2024, I'm in a better financial place and I can truly have saved, have invested, and can have a really good holiday with my friends and family.
Yeah, talking about where your money has gone, or how do you grow your money for, are there like investment or saving options that people can, you know, get involved in to ensure that they grow their money, or maybe get more money than they planned against the Christmas season?
So how to get more money than they planned for the Christmas season. Again, it comes from just really planning ahead. So if you're having a budget not just for Christmas season, but for the year, right? You've identified the key things that you absolutely need to spend on. The children's school fees, health insurance would help you save on medical emergencies, your house rent, your personal development. And then you're looking at your income, right? If my income does not match my expenses, what can I do? Can I get a new job? Can I get extra skills? Can I freelance and all of that? And then intentionally put money aside. So there are different saving apps that automatically takes out money from your accounts, maybe monthly or weekly. That way you're systematically saving, even without thinking about it.
It makes it easier.
Yes, and there's a community as well. So there's a local ajo that people do with people that they trust. They can come together, emphasis and trust. That's
why
even your savings
the ajo
platform
person may just be using it to save money for his own Christmas.
Exactly. Even the savings app that you use, November can come and they'll say they are shutting down, and then you have to fight to get your money out. So emphasis on trust during your due diligence and measuring the risk associated. So just really being intentional about it. I think the thing is, most people think financial independence is something that just happens, and they don't realize the level of intentionality and strategic moves that you have to make to have that financial independence or lifestyle that you desire.
Okay, so let's talk shopping now. Christmas is characterized with a lot of shopping. Like, even if you haven't been shopping the whole year, once it's Christmas, you suddenly want to buy this, buy that, buy that, you know, get everything that you didn't get. But how do we, are there some effective strategies that people can apply to ensure that they're not unnecessarily over shopping? Like you're just buying because it's Christmas, you have to buy.
Okay, I think the first thing, and this is something that I am learning to do, because like you've mentioned, you've spent all year round paying for things, paying for children's school fees, paying rent, going to work, and a lot of people would have barely spent on themselves. You've not even bought yourself something nice. I think it's important to remember that it's okay to reward yourself. And Christmas.
Oh, I like that. I thought she was going to tell me no. Yes, I should reward.
You know the song. You don't work, make you clap for yourself.
Yeah.
Please put your hands together. A round of applause for yourself. You've done the work, and now you're here. So it's actually okay for you to think about rewarding yourself, right? But the key is how to reward yourself in a way that you're not going into debt, in a way that is not based on comparing with other people, right? You're rewarding yourself, but it's not based on what someone else on a different income band is doing, right? And it's also, what do I need right now? So if you do not have a lot of savings, you would want to prioritize spending on things that you can always reuse. So if you're buying new clothes, new shoes, they are not things that by January it's out of fashion.
Wear them anymore.
Yeah, or okay, you spent 100K on this Ashwebi dress. Where can you resell it? What would you use it to do after that? But if you have more savings, what I'm doing for myself is to say, I want to take 10% of my savings or 30% from my savings this year and do something that is for me, for myself. Because that way you're even able to motivate yourself to work harder in the coming year. So yes, whatever works for you, as long as you're not getting into debt. And you remember that there's 100 days January coming. Very important to remember.
Okay.
Yeah.
So in the midst of all this spending, I mean, we feel happy when we spend. Anybody spending money is really excited to spend money. But then we can't rule out the fact that sometimes people make mistakes.
Yeah.
So let's talk common mistakes that Nigerians, or maybe not Nigerians, people make during the holiday season when it comes to spending.
Yeah, I think the first thing is even putting pressure on yourself based on comparison.
Let me see. Say it again.
Putting pressure on yourself.
Oh, we do put a lot of pressure on ourselves, especially when it's Christmas.
Yeah, this person changes their couch every Christmas. This person remodels their kitchen. I have to do that. But the person is
family
not
and friends
earning.
are coming from their abroad, and we have to show that we're doing well.
Everybody's going to the village. And I think that was where being honest with yourself comes in.
And your family.
Yeah. Financial independence is a marathon. So it is you and your journey at the pace that works for you. Something I always tell myself that helps me is, I can't afford it now. Doesn't mean I'll never be able to afford it.
Yeah, I like
so
that.
just really being honest with yourself and your situation and being confident to communicate it. I think sometimes the people that we've surrounded ourselves with makes it harder to say, oh, I can't come for that Christmas lunch at the fine dining. Let's do potluck at home. Like everybody brings something, we play games. But because you've surrounded yourself with this kind of people, so just even being confident and secure enough to know what works for you and your family and what doesn't. And then not planning for January. I feel like this is a recurrent mistake. Like you did it last year, you're doing it this year again. And then January will come and you want to get loan, right, to cover your basic needs. That's poor planning, and you don't want to start the year making the same mistakes that you did the previous year. And buying more than you need, especially with food. What is the food that you want to eat during Christmas that you cannot eat at any time of the year, really? So if you don't eat it now, you cannot eat fried rice in April or in May or in
But there's something about it happening during the Christmas season. Like, it gives this kind of feel, you know? So you don't blame them.
Yes, definitely. But just really enjoying the season, but without losing sight of there is a tomorrow that needs to be intentionally planned for.
Okay. Yamisi, thank you so much for all the insight you've given us. We're not done. We will be back. But right now, we'll bring you something that we heard from the streets. We went to the street to talk Christmas on a budget, and this was what we came back with.
I'm going to manage. It will not be like before. Even the economy is not like before. So even though if I'm supposed to give you 1 lap of chicken, I'll give you half. I'll give you half. If I'm supposed to give you 2 cups of rice, I'm going to give you 1. So everybody will understand we are in this together. So everybody will understand that the economy is not like usual.
Well, nothing much. Either we like it or not, the period will still come. Christmas will still come. And we celebrate. So whatsoever little finance is in your hand, you have to just plan and make use of it.
Managing it is like any visitor that visits me, I will entertain them, of course, to manage. I'm not trying to impress anybody, say I must buy wine or I must give this person goat meat. It's whatever I have and my family are eating that I give everybody.
I intend to manage my finances by not spending unnecessarily, only spending on things that I really, really need. Not just spending because it's Christmas and I have to do this, I have to do that. So that's how I intend to manage my finances. And plus, I'm not doing any unnecessary you know, any unnecessary journey. I'm not going here. We know how the transport is high. So that's another way I intend to manage my finances during this festive period.
How I actually intend to manage my finances this season, though, is just to spend less and still know that next year is still coming and other things are at hand for you to do. So you got to know what you're actually spending, because you might say, okay, let's spend all now. The next thing you might be expecting another one and it's not going to come. So I actually intend to spend less, and also to my loved ones as well this season, because it's actually a season of love and a season of giving.
It is definitely a season of love and a season of giving. It's Christmas. I mean, what's not to love or give this season? This is still the Madly Show. If you just joined us, of course, you've missed a bit of our conversation, but you're just in time for much more on the show. And we are talking Christmas on a budget. I've been talking with Yemisi, and of course, we're now being joined by Daisy Oge, who is an event planner.
Hi,
Daisy. Do you know I'm hailing you? As in, that's how I'm hailing you. Like, this is the season where you guys collect our money. It's like all year round, we'll gather our money, and then in December, we'll give it to Daisy. Daisy and her people.
You know.
But this year, we're getting wiser. Yemisi is here to give us sense. I mean, we have to spend wisely. We have to do it on a budget. So we don't spend all our money. I mean, the same way you want to make money, we want to make money.
Yeah.
But
save
anyway,
money.
Yeah. So first of all, let me start by hearing your, like, why do you love Christmas? Why? Of course, it's your favorite time of the year as well. So what's your most memorable Christmas? What's your, like, what do you love most about Christmas and your most beautiful Christmas memory?
I would say my most beautiful Christmas memory was 2010.
Okay.
And that was when I started doing events.
Wow. Right. That was when you started to hammer. We've caught you. That was when you started to hammer.
It was interesting because I didn't start with events.
Okay.
I started with face painting, and that particular Christmas, I was like very small. Like I'm like 22.
Wow.
So that particular Christmas, I made money. I brought it back home. Everybody was amazed.
Wait. Not to, you know, call you out on the show, but did you say you are 22 or you were 22?
I'm 22 now.
You're 22 now?
I choose to be 22.
Okay. Okay, now you have said it properly. Go ahead.
So I made money that year, and I was like, oh, so this works. And then the next year, I decided to, you know, go all in, started events, and I'm like, okay. So I think that is my most memorable Christmas experience I've had.
Because that was when you started to gather money, you know, you started to count the paper. Anyway, so we're talking Christmas on a budget. As much as this is your season, like I said at the beginning of the show, it's looking like this Christmas is not Christmasing. So people need to, you know, calculate their money properly and decide what they want to spend it on before spending it. Just before I start asking Daisy questions, remember that you can join us on the show by sending your messages to 0811-778-2020. The number should be on the screen at the moment. So please do not call, but send your messages and I just might read them on the show. So Daisy, back to you.
Okay.
So how do you guys, I know you want to get money. In fact, if I tell you I want to spend 10 million on this event, you know you can do it with 2 million. You say bring the 10 million. But then we're talking on a budget. So how do you help your clients achieve a realistic budget this Christmas season? I mean, they want to have a good time, they want to have a good event, but they don't have so much to spend on it. So how do you help them achieve a realistic budget?
Okay, I would say for events, people need to have their non-negotiables. There are the things you know you're not going to compromise on.
What could be non-negotiable?
So for some people, for events, they are big on the experience.
Okay.
They want to have an experience. For some other people, they're big on maybe the souvenirs at the event.
Right.
For some people, they're big on the aesthetics. For some other people, they're probably big on food. Right? So when you're doing events, you can now tell them, okay, what do you know you do not want to compromise on? Then we can now focus on that, and then we can probably have the others maybe minimal, something like that.
Okay, so I'm going to also ask this,
Okay.
yeah? Of course, when you're planning an event, there are different, maybe the word category is not the best, but there are different things to the event. So you like need to put together a theme, or you need to put together a group. Group is not the word. A team, you know, to help you achieve that. So how do you put together, what are the most important things to help you put together a budget-friendly team to achieve a great experience, like you called it?
Okay, so for an event, would have music. Music is great, right? Yeah, sure. You'd need to have a very great DJ, have a very good MC, have a hype man if possible. So for this event, you decide for yourself, okay, there are MCs that will charge you 1 million.
Yeah.
And there are MCs that will charge you 100,000, right?
Yeah.
So if you're sure, okay, maybe I don't want...
MCs that will charge you 50K.
And there's some that will do it for free. You can call.
I mean, you can cash in on family and friends.
Actually. Then for events, you are going to talk about your photography, your videography. It's expensive.
And very important too.
Very important. I've had events where people said, where my client said, you know what, I'm not going to get a videographer, I'm going to use my phone. And it came out great.
You better have an iPhone 15.
You know, these days we have content creators or, you know, put up a video. All they have to do is just clean the camera, make it really nice. You would see, you wouldn't even know it was done with a phone.
Yeah, because you now have apps that can help you do all the editing.
Exactly. Then for events as well, there are different...
Photographers, we're not trying to, you know, spoil your business. We're just trying to enjoy Christmas on the budget. So yeah, please go ahead, Daisy.
Then for your event as well, there are different locations you can use. It can be indoor,
talk about venues
it can be outdoor, it can be in your house. We have free parks in Abuja, for example. You can go to Millennium Park, you can go to Park and Zoo, you can go to, you know, all these small parks. You would have cut on the amount you would pay for a full-blown indoor venue, right? Then what else for your event? Your event planner is important as well, because you need to pay me, right?
Yeah, thanks for putting that in there. Yeah, we got it the first time.
Yeah. However, you can also consult, right? You can tell me, I have an event. I don't want you to be the event planner, but I just want to consult. What do you think I should do, what I shouldn't do? That way you've cut off maybe up to 50% of what you would have paid an event planner, although an event planner is important, of course. Then food as well, right? For your events, you can decide to outsource everything. She mentioned something about potluck and all that, right? You can get people to say, okay, I'm having an event, you bring this, you bring that. You would have a great event. It can be a buffet setting. You do not necessarily have to go to, you know, some a la carte place or the most expensive, exquisite
even though we like that.
But, you know, because we're on a budget, right? You have to find a way to cut costs and all of that, right? Then for your drinks, the events I've been to, or the events are planned, that there was no alcoholic drinks. We know that alcohol is expensive, right? How much they sell VSOP? 350K,
okay. Right? we can mix it in our house. Forget about
you know.
Anyway, let me talk decoration now. So decorations are very, very important to every event. I mean, if I walked into a room, I can tell it's Christmas by the decoration.
Absolutely.
If I walked into a birthday party, I can tell by the decoration, even if it's a wedding. So my question is, are there budget-friendly decoration ideas that people should, you know, incorporate in their events to help them not break a bank?
Oh yes, there is do-it-yourself.
Thank you for pointing that out.
Yes, there is do-it-yourself.
What if I don't know how to do it myself?
There is YouTube.
Okay.
Yes, there is YouTube. There is also the family and friends thing again. It's Christmas. Everybody's bonding. We're coming together. We're all lovey-dovey, sweet, you know, spending time together. So you can go to the market, buy everything you want. Everybody comes together. You know, everybody's brainstorming, thinking of how to fix this decoration. For example, with the Christmas tree, it's a lot of work. So imagine you have a family of 3 or a family of 5. Everybody can come together and fix the tree. In 2-3 days, you have your tree up already. You know, then for decoration as well, you know, decoration mustn't be luxury decoration. Right. For weddings, you have the flowers. Some people really want flowers that are live flowers. It's expensive. Even your fake flowers are expensive. You can decide to do balloon decoration. You can decide to do your satin decoration. You can decide to have your printouts, your backdrops, and all of that. It will still come out well. So whichever way, if you have a budget, there is always a decoration for you.
Okay. So let me take some messages because lines are buzzing. Please do not call. Just send me messages. I'll read them on the show. So this is Savior from Adamawa Stage. He says, my question is, how can one plan a Christmas shopping budget? The question is directed to Yemisi. Yeah. So you want to take that before I take other messages?
I mean, you can, okay. How to plan a Christmas shopping budget?
Yes.
Okay. The first thing you need to identify is how much do you want to spend on your Christmas shopping? Like I mentioned.
How much do you have?
Yes.
Because I want to spend 5 million and I have 5K.
I was about to go to how much you have.
Yeah.
So how much can you potentially get in December, in this month, right? How much do you need on your other core expenses, necessities that you need to have, your NEPA bill, and core expenses that you need to pay in January as well. So when you take that out, what do you have left? That is your income for your Christmas shopping. And then you can now use that to plan, okay, with this income that is left for Christmas shopping, what are the things that are important to me, right? Do I want to have a party? Do I want to go to the park? So what are the things that I can afford with this budget? And you'll be surprised the number of free activities or events that are happening in this period. Yes, and a lot of, at Abuja, we're so blessed to be here because we have a lot of parks, a lot of activities. You can go to the park. We have trees. You can go to the park and have a great time. You know, you can easily visit friends without traffic. You know, all of those things, they add to your Christmas experience, and these are things that you can enjoy on very minimal budget.
Okay, thank you so much for that, Yemisi. I hope Savior got that. This person, no name and location, just says, I want Daisy to plan my event.
Oh, lovely. We have an event.
All right, so this is Bisola from Taraba. She says, I enjoy your program. Thank you for that. Thank you for telling us how to manage our money, and I like both guests in the studio. Thank you so much.
Thank you.
And then this is Joseph David. Says, it's Christmas season, I'm excited. Yeah, we're excited as you are, David. And this is Obe from Bayelsa. He says, I'm interested in working in events. Any tips for me? You're going to have to help Obe from Bayelsa, who's interested in working in events. But this person says, I like the Christmas show. Thank you so much. We like you too. Thank you for watching. And then Emmanuel from Benue State says, my Christmas celebration this year is already budgeted, but it's unlike before because of the economy in our country. How do I manage? I mean, with everything you've been saying, Emmanuel should be able to figure out how to manage. But I have a question for you, Yemisi.
Yes, please.
You know this period, okay, assuming like when I was growing up, I won't exactly say it's the way for children nowadays, but when I was growing up, you know, my parents would buy three outfits, 2 for Christmas, 25th, 26th, and then 1 for the New Year. But not everybody, of course, could get that. But assuming children used to get that, and then at some point they're no longer getting it because the economy has started to economy. You know? So how can parents teach? How can parents teach their children this season to be financially responsible? Okay. You know, because we're talking Christmas on the budget. So if I used to eat like I normally eat with 2 meats over the throughout the year. Then Christmas I get chicken, I get beef, I get goat meat. And then this Christmas you're giving me just 1 chicken. So how do parents teach their children? You know, to
I think financial responsibility and contentment are key skills that children need to have. But it's not something that you start teaching them because it's Christmas. So it needs to have been a part of the training and conversations.
But it's only Christmas
that you're
having
having
reducing our ration.
But if they understand financial responsibility, then it makes it easier to have that conversation. And you can also let them take part in the planning. So look, this is our Christmas budget. What do you want? What can we do with this budget? That way, they know when the money has now finished, and they can see they're able to learn priority as well, being able to prioritize what is important